Health Focus is brought to you by National Medical Stores, NMS, passionate about your life.
Breast milk is the ideal food for infants. It is safe, clean, and contains antibodies which help to protect against many common childhood illnesses. Dr. Victoria Nachibuka, a neonatologist and pediatrician at Nsambia Hospital, says breast milk provides all the energy and nutrients that the infant needs for the first months of life, up to 1/3 during the second year of life.
Breast milk reduces the number of babies who are dying due to prematurity. In our unit before, we used not to use a lot of breast milk. Our survival of the preterms was about 75%. But when we started campaigning and using breast milk, of course with other things, the survival of our preterms has actually increased to about 94%. So breast milk boosts the baby's immunity from the start. Breast milk also has been found to reduce on the number of allergies. Many times you find so many mothers with babies that have asthma, they have issues with the skin, eczema. It's because we have not breastfed our babies enough. When you breastfeed babies, especially in the first 6 months, you're going to have less episodes of diarrhea, less episodes of pneumonia, less episodes of infections in the ears.
According to the World Health Organization, exclusive breastfeeding could save the lives of 820,000 children every year.
The baby is born, there are many lying down. At 6 months, they are sitting down, they're starting to crawl, they're using a lot of energy. So breast milk alone may not be enough, so that's why you have to bring in the other foods, what we call the complementary feeds, to also assist the breast milk so that the baby can have sufficient growth.
Dr. Nachibuka says all mothers are able to breastfeed. However, the new mothers always need to be helped.
But if you counsel them very well, if you're patient with them, you show them how to do the breastfeeding. Many mothers cope.
The act of breastfeeding can only be done by a mother, but understanding the topic actually helps the rest of the family to know their role in how to support the mother to adequately breastfeed the infant and avoid preventable circumstances which may include death.
So if the mother does not breastfeed her baby in the first 1 week or 2, the breast milk production actually reduces. But the sad thing is that even the amount of salt in that milk actually increases. So as she's breastfeeding this baby, the baby is going to become dehydrated, but the milk that she's feeding on the baby has a lot of salt. So we have seen babies who have come here actually that have had experienced inadequate breastfeeding. They present with fever, weight loss, significant weight loss, and kidney failure. Actually, some of them die. And we check in their blood, and the salt is so high, up to what they call sodium, up to 200. They bleed in the brain.
And to have your baby well fed, you need to ensure proper handling, especially to ensure that the baby has latched on.
When this mother holds the baby, should be well aligned in a horizontal way, and the hand of the mother should support the buttocks of the baby so that the baby's tummy is facing the mother's tummy and the head well supported. Most probably the elbow of the mother is the best position, or even if the head is free. And then when it comes to attaching, the baby should be able to open their mouth wide as the mother's nipple is getting close to the baby, as the mother pushes the baby to the breast. And the areola, which is the darker part surrounding the nipple, a big part of it should be in the baby's mouth.
The global theme for this year, Supporting Breastfeeding for a Healthier Planet, calls on governments to protect and promote women's access to skilled breastfeeding counseling, a critical component to breastfeeding support. Walter Mwesije, NTV.
National Medical Stores, NMS, passionate about your life. With support from the Ministry of Health. Procure, store and distribute essential medicine and medical supplies to all government health facilities in Uganda.